Lakeland Regional Health Medical Center says the recent rise in cases has led to an increase in its hospital deaths.
Awful situation. For that reason, the hospital tells 10 Tampa Bay it is adding a portable refrigerated unit in addition to the hospital morgue. In a statement, it said each surge during the pandemic has caused more deaths than normal at our medical center, and we take the appropriate steps to properly handle the bodies of the patients who pass away.
Well, Lakeland Regional says it's not at capacity, but its workers are really feeling the strain of COVID. 10 Tampa Bay's Jenny Dean is live there this morning. Good morning, Jenny.
Good morning. Let's go over the numbers released by the hospital, the numbers of COVID patients that they have here right now. 442 patients being treated for COVID in the hospital. Behind me, there are 65 in the intensive care unit. 57 of them are on ventilators. And as much of the country continues to battle the coronavirus, we have learned some big lessons over the past year that can help keep us healthy. So I reached out to a doctor, Dr. Ken Redcross, board certified internal medicine physician. His practice is very patient focused. He has even written a book on the importance of the doctor-patient relationship. And he says the communication with your doctor is more important than ever, especially when it comes to preventing coronavirus and other illnesses.
During this time, as we're going through the fourth wave of this coronavirus, vitamin D should be a hallmark of what we're all doing. Look, the studies are there. We used to think way back a long time ago, Jenny, that it was all about bone health, but now we're recognizing that vitamin D is something that we need to balance our immune system. And what better time than now to really focus on our immune system. So,
besides a vitamin D supplement, Dr. Redcross recommends the COVID vaccine for everyone, even kids and teens 12 and up.
We all know that we want to get back to regular life, but the vaccine has to be a part of that discussion. And investigate with your pediatrician, why is it good for my child or why I have issues with it.
Finally, he says, wear a mask in crowds. For those who question the science, Dr. Redcross says this.
Would you want to go in for an emergency appendectomy with your surgeon without a mask on? Would you want your surgeon leaning all over you, cutting, opening, suturing with no mask? And the point is, of course you wouldn't. But why is that? That's because you do not want the respiratory germs or what have you.
So vitamin D, masks, and of course vaccines. Talk to your doctor about all of those things. Dr. Redcross says if we can just do these few simple things, we'll be out of this pandemic sooner rather than later.
The doctor making it plain to make his point. By the way, if you want to get a vaccine, treatment, or a test, we have a list of locations on 10tampabay.com.